thank you and welcome to our Future Focus series. Today's guest is Danielle Pettifor, Doctor of Veterinary Medicine from Blue Pearl Animal Hospital. This addresses the pathway of agriculture, food, and natural resources, although sometimes veterinary science can also fall on health sciences, but we kind of put it in agricultural, food, and natural resources. Please note that guests of our Zoom webinar will have view-only capabilities and do not have access to video or audio. Please use the chat feature to ask any questions. The host will monitor and ensure guests' answers are all gathered for our guests. And this session will be recorded. So if you're not able to view it today, or if you'd like to share it with somebody else, you're able to do so. So Danielle, I'm so glad you are here. Should I call you Dr. Danielle, or I've heard that there might be a Dr. Pet because your last name is Pettifor. What would you prefer that I address you as in our interview today?
Dr. Pet's easy and fun to say, so you can go by that.
It's super fun. It makes total sense, like you were born into the profession.
Exactly.
So, Dr. Pet, let us know kind of what you do. A little bit about Blue Pearl Animal Hospital, if you will.
So I'm an emergency veterinarian at Blue Pearl. It's actually called Blue Pearl Specialty and Emergency Hospital because we have an emergency department and then specialty clinicians as well, including surgery, oncology, neurology, and internal medicine. So those doctors actually go to school for a couple more years, or they do what's called a residency for a couple more years to become a board certified specialist in their specific area. I went to school for 4 years, equivalent of medical school, and am a general practitioner. So I did not go on for additional training. But that qualifies me to be like a normal vet that you would have your animal go see for vaccines and to be spayed and neutered and different illnesses. And then I can also work as an emergency vet as well. So right now I work in the ER and I see animals that are either too sick to wait to go to an appointment at their primary care vet, but are like stable, not like actively dying. And then I also see the ones that are actively dying, like hit by a car. It's a big adrenaline rush and a scary situation, but it's rewarding to be able to save animals' lives. So that's kind of in a nutshell what I do.
That is awesome. And I appreciate kind of that scope of, I had no idea that veterinarians could specialize in certain areas. And Blue Pearl is in Grand Rapids, correct?
Correct. We are the only specialty hospital on the west side of Michigan, all the way, I believe, all the way from like northern Michigan to southern Michigan. There's a couple of specialty hospitals in on the east side of the state, but we have people traveling to us from Indiana, all the way from the UP, driving several hours to come to us. Being a specialist is not as common as being a general doctor, so they're far and few between, and their wait list to get into them is very hard. So working as an ER doctor at a specialty hospital, I do see some patients who are just, their owners feel like they are just too sick to wait for their appointment. So they come in kind of through the ER to get to the specialty a little bit quicker. But it's a really unique experience. I really like it because we have a lot of diagnostic tools at hand that a general practice wouldn't have. And so I can often help owners get to the bottom of the problem rather than kind of practicing trial by error medicine and like ruling things out when certain treatments don't work. I can actually find the diagnosis with specific diagnostic tools. So that's really cool.
Well, I agree. I think that's super rewarding in what you do. So let me go back to when you were in middle school or high school. Did you at that point know that you were going to be a veterinarian?
I did. I feel like it's a pretty common thing. If you ask most vets who wanted or are vets, majority of people have always really loved animals. And when you love animals a lot when you're a kid, people are like, oh, be a vet. And so that always kind of stuck with me. Um, I started pursuing what it would be like to be a vet in high school. I started with internships my junior year. I went to the National Youth Forum on Medicine. It was held in Boston that year. And I, at that point, wasn't sure. I knew I wanted to be a doctor. So I wasn't sure if I wanted to be a human doctor or a vet, but it was much easier for me to intern with vets. So I spent that experience interning with doctors. I was there for a couple of weeks. And I figured out I didn't want to be a human doctor at that point. And then my senior year, I participated in an internship class and was able to go to various clinics around the area and a couple days a week and learn what it was all about. You don't get to exactly understand what being a doctor is like until you do it, quite frankly. But I was able to feel like I wanted to be in that environment and kind of understand some of the stress and some of the daily tasks that a vet has to do. So
I'm glad that you mentioned those early experiences for you that were so influential. One that ruled it out for you, right? That you didn't want to be the human doctor, but the one that ruled it in. And like you said, it might not give you the full experience of being a doctor because in high school, you don't have a skill set for that. So that makes sense. But it gave you kind of a look behind the curtain. And as I was just sharing with you, before we started recording, I wanted to be a veterinarian up until my junior year of high school. And I had a similar experience, went to MSU, their vet visit, realized really quickly that even though I love dogs and cats and have a ton at my house, it's not what I wanted to do for a career. And so those early experiences really, really make a difference. And we really find that as we talk to all of our community partners like yourself, those early experiences really help shape your future and what you're going to be doing. So
yeah.
tell us about, okay, you leave high school and you're going on to college. Where did you go to college, and what does a college experience look like for somebody going into veterinary medicine? Much like, when you're going to be a doctor, a lot of times those students go for 4 years, but then they have to go on and apply to medical school. How does that look like for a veterinarian?
So I'm like a super planner when it comes to like big like life events. I like to feel like I'm sort of in control of what's happening with going to happen with my life. So I, from a young age, was thinking about what I could do to be a vet and how I could get there and make myself more likely to get into vet school. So vet school is very hard to get into because there's actually only 32 schools in the United States. So that means there's, less than one per state. There is a couple states that have two, but some states don't have any. And the amount of students that apply to each school is like more than 1,000, and they only accept usually 100 or less per year. So it's extremely hard to get into, and you have to make yourself very look really good. And so that's why I started doing the internships in high school to get myself experience, because that's one of the credentials. And then when choosing a college, I looked at their acceptance rate for vet school, talked to their pre-vet advisors. And then I was also an athlete, so that was part of my equation. I played volleyball in college. I ended up going to a small college called St. Mary's College. It's in Indiana, because I wanted to not be in a huge student to teacher ratio. I wanted to have some individual attention, because I knew as a person that I needed that in order to try to succeed. So I tried to set myself up for success. But going to college was a huge different experience than high school for me. It took me a while to get my footing, and I didn't do as well in classes as I should have, but I still apply. I got all my prerequisites and I applied to that school, but I didn't get in the first time. So you have to meet a lot of prerequisite standards, like certain classes as well as experience. And then you have to have things on your portfolio that make you stand out. So I actually majored in psychology on top of getting all of the vet school prerequisites, because a lot of people are pre-vet majors. And so I thought that it would make me stand out. And again, I'm a super planner. So on the off chance that I never got into vet school, I wanted to have a backup plan, and psychology interested me. So I didn't get in the first time that I applied. And so I ended up getting married after I graduated college. And shortly after getting married, I started taking more classes to add new things to my portfolio, and retook a few classes that I needed or knew I could get a better grade in if I focused more, and made my portfolio look better and made me more prepared for vet school. And in the right timing, I applied again, and I got accepted at that point. And me and my husband decided at that time to make it an adventure, and we actually moved to the Caribbean, and I went to a school called Ross. It's actually based out of New Jersey. But we didn't have kids yet and had been married for a couple years, and thought it would be a chance of a lifetime to travel and accomplish my dream at the same time. So we did that, and it was the best choice for me because, again, I knew what I needed to succeed as a learner or as a student, excuse me. And the school is known for being hands-on, and it also is like kind of an isolating experience. And I learned in college that I needed to take away all the other distractions, because even though I'm focused and always knew what I wanted to do, I was easily distracted by all of the other things that you could do in college other than study. So being on that island allowed me to focus on what I needed to focus on. And I was able to highly succeed in vet school, and graduated and was in the honor roll and in the top 10% of my class, because I was buckled down, ready to succeed at that point, and knew if I didn't do this, I felt like I'd be unhappy for the rest of my life. So I needed to succeed at this point. So I did, and then I graduated, and then I was a vet.
Oh my gosh. So, and what a story as far as, perseverance, right? Of, if I don't get in the first time, I got it. And you went back and took some classes to kind of, and like you said, pad your portfolio, because you're selling yourself to stand out amongst a lot of applicants. We had a question here in our chat. How many vet schools did you actually apply to?
The first time I applied to 11. I didn't get in. I
Okay.
applied to 11. It's like we spent a lot of money. My parents did to try to, it's expensive to apply to a lot of those schools. So it was a very big disappointment, and it was very hard to go through, to be honest. I felt like I tried really hard in college. Retrospect that, I knew I could have tried a lot harder. I could have focused a lot more, and I would have saved myself a lot of heartache if I would have just focused more. But I didn't. And I just don't think it was the right timing for me. I think everything happened for a reason. I got into school and was able to succeed so much because it was the right timing for me. I just wasn't mature enough or ready enough when I tried to get in the first time. So I had a few lessons to learn, and ended up getting in. But yeah, I applied to 11 the first time, and then I applied to 3 the second time, and I got accepted to 1 and on the wait list on the other 2. So I was much more ready as an applicant at that point.
Wow. And again, that speaks to the grit. I know a lot of our students, when we talk about those skills of perseverance and grit, and don't give up, if that's your dream, keep working towards it. So I applaud you for that and sharing that story. And also knowing the rigor, not only that college provides, but now if you're going on to be a veterinarian, the rigor of that, it's not a walk in the park. not to
No, not
deter
by any
anybody
means.
from, yeah, not to deter anybody from going down that road, but you want to know what you're getting into. So like you said, you can
Certainly.
set yourself up for success. And that's what's really
Certainly.
important.
Mhm.
Yeah, knowing yourself. So how, after you got, done with college and you graduated super at the top of your class, what did you have to do, if anything, any additional training or after you graduated before you landed this position here at Blue Pearl?
So when you finish your vet school, so my school was an accelerated program, so I finished in 3.5 years. Normally, vet school's 4 additional years. You do at least, I think every school is like 2.5 years of in-class training, so by the book training, going to lectures, taking exams, all of that. And then the rest of your training is in a hospital where you work with practicing clinicians and get to shadow them and follow them and practice being a doctor with them by your side. And so that's like standard for human and veterinary medicine. And then the difference between a human and veterinary medicine is human doctors have to then go on for an internship and a residency in order to be specialized, because like all human doctors are super specialized. In veterinary medicine, you can graduate. So after you finish your schooling, you have to take a test, and that's your licensing exam. And if you pass that, then you're licensed and you have to apply for all your other like drug licenses and so on and so forth. So you can prescribe things, and then you're able to be a practicing vet. You have the option after getting licensed to go on for an internship year to get some more practice at being a doctor with guidance. Like you continue to work in like a specialty hospital or teaching hospital. And you do that for a year. And if you've completed an internship, then you can go on to a residency and become a specialist. Most residencies are 3 more years. I just graduated, took my licensing exam, and then I didn't continue training because I wanted to just be a general practitioner. I don't do one thing for very long very well. I like things that change. I like to see a multitude of things. I like to be able to do a lot of things. And as a general practitioner, you are literally a dentist, an anesthesiologist, a radiologist, a pharmacist, all of the specialties all in one, because you're the only doctor there. And it is not the common thing to do to go to a specialist. So the general public would just take their animal to their primary care vet, and that would be it. And so that's what I did for the first 1.5 years. I did everything from little vaccines on little tiny puppies to major surgeries to save lives. And that was fun. But I was most happy when I was saving lives with the acute illnesses. And so that's why I sought out the job at the ER. I also had a daughter, had my daughter, and being a general vet, a primary care vet, you work 4 to 4.5 days a week, 10-hour days minimum. And you're usually there later than what you're supposed to be, because you can't predict when animals are sick and when they need you. So you're often there a little bit later. And I was just away from home a little bit more than I wanted to be. And as an ER vet, I only work 3 days a week, but they're 12-hour shifts. But for me, that was a more appealing work-life balance. And so oops, can you see me? Sorry. Okay, there we go.
Sure can.
So that was a more appealing job for me for those 2 reasons. It was more exciting and focused more on what I was most excited about with veterinary medicine after practicing for a while, and it met my family needs at the same time.
I think that's important to point out. First of all, going back to how many years it takes to be a veterinarian. We're talking 4 years undergrad, and then we're talking 3 to 4 years just to get to that general practitioner. And then beyond that, if you're going into a specialty, we're talking another 3 years. And that's true of, like you were saying, veterinary medicine or human medicine. And so you've got to be committed. You've got to, again, that perseverance and, sticking to it because it's a long road. And
Mhm.
so, and I also, I appreciate you sharing kind of like the difference between being in a veterinary office and those hours of that family and life home balance or work balance, and then also the advantages or difference of what it would be working in an animal hospital and how that was a better fit for you. Because I think that's important when you're looking at a career, you have to look at all those factors. What do you want your life to look like, and how can you shape that?
Mhm.
So talking about a day in the life of Dr. Pet. So
Mhm.
when you go into Blue Pearl, what does
Mhm.
that day look like for you?
Yeah. So right now I'm a daytime ER doctor. As an ER clinician, someone has to be there around the clock every day of the year. So I work, the shifts at the ER are 6 a.m. to 6 p.m., 2 p.m. to 2 a.m., and 6 p.m. to 6 a.m. So they're all 12-hour shifts. I work during the day, so I get there a little before 6. And when I get in there, the night shift doctor rounds me on the hospitalized patients. So the animals that are too sick to go home that need things like IV medications or IV fluids or specific monitoring to make sure that they stay alive. They round me on what happened overnight and what the plan is for the day. And then once we're done doing that, I go and evaluate the ones that are going to stay on my service. So they're going to be my patients. And evaluate how they're doing this morning and read again through the record and make a plan for the day, call their owners, change their treatments as I see fit based on their physical exam and any diagnostics they've done in the morning. And then I take care of them all day until they need to leave. But on top of that, once the specialty clinicians get there, they usually get there a couple hours later. I then round them. So I speak to them and I give them an overview of the animals that are in the ER right now, but need to be transferred to them for specialty diagnostics or treatments like MRI or endoscopy or an ultrasound or some type of specific biopsy, surgery, chemotherapy. All of those things can be done. So then I tell them and they take them on as their patient. So once all of that is done, and during all of this, because I'm an ER doctor, if an animal's sick, it's sick and it comes in, and I have to then take care also of that patient that comes in acutely ill. And I get a history, or my technicians. So technicians are similar to nurses, but they go into the room with the owner. They figure out why they brought them in. That's the tricky part about veterinary medicine is we rely on a being that isn't actually experiencing the symptoms to tell us what they're seeing or what their animal is experiencing. So that's what's kind of cool about veterinary medicine is it's this huge puzzle. You have to be someone who like really enjoys like mysteries or puzzles because you have to be very inquisitive and ask a lot of questions. And still sometimes, even a case I had yesterday, I was trying to figure out what was wrong with his dog for 2 hours. I had multiple specialists look at it. And then when we were just going to try a treatment and see how it went, the owner finally said one little tidbit of information that made the whole thing obvious. But it took several hours to get to that little piece of information. And so it's fun. It can be frustrating because of that, but it's also fun for me. So I see multiple patients throughout the day. In the ER, I see usually around 10 patients a day, usually combination between hospitalized patients and outpatients. Usually ranges anywhere from like 5 to 15, depending on if we're slow or it's really busy. And then in general practice, usually in order to make the business money, because costs are a lot less at a general practice, you have to see around 30 patients a day in order to be able to justify a good salary. So yeah, in the ER, it's just they're sick, I figure out what's wrong with diagnostics, I figure out what treatment I want to do, and that treatment can either be sending them home with medication or keeping them in the hospital. And at the end of the day, I make sure that everyone's taken care of, and then I get to go home. I don't go home on time ever. You can ask my husband and daughter, they don't plan on me being home for dinner when I'm working. I get home usually, a couple of hours late, sometimes 6 hours late. But that's just part of the job.
That is an important piece to share. I appreciate that. You're really casting a light on the reality of it, so somebody can get a really good view of, what that's going to be like. Because as a doctor, sometimes, what if something comes in, you can't just maybe leave.
Right.
Okay, I'm done checking out, and it doesn't quite work that way. So, what are some of the tough things about your job? Name one or two of the tough things about your job.
Something that took me a long time, it's still difficult sometimes to get used to, is euthanasia. That's something that is, it's not in any other career. So we have the opportunity to limit suffering in animals by performing humane euthanasia when necessary. It's it's hard to not look at it negatively or to become super emotional every time you're doing it. But you also don't want to block out all your emotions, because you want to empathize with the people that are going through it, because it's sad and a terrible experience, even if you can look at it on the bright side. But it is very emotionally difficult to deal with. And that was one of the reasons why, honestly, I thought I might like ER medicine more than general practitioner, because as a general practitioner, you have to go see a patient that needs to be euthanized, and then go see a puppy who's really happy, and then go see a patient who's really sick, and then see a puppy. And so it's kind of like a emotional roller coaster
Sure.
throughout the day. And that was kind of emotionally tiring for me. And in the ER, everyone's just really sick. So it's kind of a little bit more stable, although still tiring, but that's hard. And then the other thing that I'd like to say, because it was even everything I went through to prepare to be a doctor, I don't know if there's ever really a way to be prepared for the responsibility that comes with being a doctor. You never really quite understand what it's like to have a life in your hands. I kind of understood that when I knew I didn't want to be a human doctor after that 11th grade experience. I knew I could never handle making a mistake with a human, because reality is you're human and we're not perfect, and mistakes are going to happen, or you're going to miss something. And you try not to, of course. And anyone who's a doctor is usually like a perfectionist, like you're rechecking, trying to figure something out. But that's what's really great about working in the environment that I work in, is I have so many colleagues that are brilliant. And if I don't know the answer, I work with wonderful people who I can collaborate with to try to figure it out. And I love the medicine that I get to practice where I'm at right now. But the pressure that comes with being a doctor is great, and it's hard to handle, and it takes a long time to get used to it. But if you don't work in the appropriate environment for your personality, it can limit your success and probably your longevity in the career, because it's really hard to handle. So having a
I
good
love
support system.
Yeah, I love how you mentioned, even throughout this interview, just knowing yourself and the right environment to be in for you. So you talked about your great colleagues. You talked about getting to practice this awesome medicine. What is one more thing? We talked about the stuff that's hard, but what is the awesome thing that you love about your job that just makes you so excited to go into work every day?
Um, helping the people get their loved one back home with them. A lot of people actually, I think, go into vet med because they absolutely love animals, and I do, but I love people a lot too. And it's
Mm.
amazing to be able to see this owner come in and just be distraught and have no idea what's wrong with their animal, and me be able to figure it out and help them and get them home with them. This relief that they feel, the happiness that they feel, makes it all worth it for me. And of course, I'm happy to see the animals get better too.
Oh, absolutely. I think that's really great. And so now, again, talking about those middle school, high school students, what are some skills that would be really helpful in veterinary medicine? And what are some subjects that they might be studying in middle school and high school that would help them prepare for a future career in veterinary medicine?
Most of what I do is critical thinking. So, any class that you can take that pushes you beyond your comfort zone is a class that you should take, because every day I'm pushed beyond my comfort zone. And I have to be able to critically analyze the situation beyond what information is offered to me, and think of potentially what these people are leaving out to try to answer the question that I need answered to find out what's wrong. In high school, rather than taking elective classes, I took more science classes. So I took the AP science classes and stuff instead of taking the fun courses. So trying to push yourself beyond what you think your capabilities are, I think, is important, because like I've tried to say, like, it's a really hard road and it's a really hard career, and you really have to be devoted if you want to do this. Um, Time management is really important.
Mm.
So working on time management skills of any sort, like being able to build yourself a schedule, try not to be a procrastinator, although I won't say that I'm not a procrastinator. If I don't have like a schedule, I do procrastinate. So I'm not perfect at that either. But it's important. So time management, critical thinking, interpersonal skills, like you have to not just be aware of yourself, but the people around you, not just the clients that you're helping, but your colleagues, because it is such a stressful environment. Knowing how to work with others is really important, because it just makes it such a better environment to work in a place where you're not mad at each other or being mean to each other all the time. So trying to understand other people and help them out is important. So things like being a part of a team of any sort, whether it's a sports team or a chess or theater or music or something, being part of some type of group and learning how to work with others is really important.
That is a really, really good advice. And I think important to note sometimes being parts of those teams, almost any job or career that you're going to go into, you're going to be a part of a team and you're going to have to work well with others. And especially in a career like that, sometimes that's stressful situations. So being able to handle that is really important. So, Dr. Pett, as we're wrapping up our time with you, and I'm so pleased and excited the things that you were able to share, just really, really powerful nuggets. So, here's one last little question. What is the final word of wisdom, final nugget that you would pass on to a middle or high school student thinking about going into veterinary medicine, or just thinking about their future and what they want to do? What would you pass on to them?
So my husband is actually a career specialist, and so we talk about this all the time, because I took my training was so in depth and for so long, and I'm in a lot of debt because of it, right? So I have a lot of things riding on me succeeding in my career, and there were some things that I wish I would have focused on more. And so I have a great answer for you. You need to think about what you want your life to be like. You need to step back, think about what makes you happy, but also what you think you're going to want your life to be like what kind of house you're going to want, what kind of car you're going to want, what you want your family to be like. If you want kids, if you want to be home at a certain time, or if you want holidays off or summers off, all of those things really matter and are really going to make a huge difference in your fulfillment in your career and your life in general. And so if I could go back and think about that a little bit more, maybe I would have. I think I would have still ended in the same spot I was, but it took me a while to find the happiness that I have now. And maybe I would have gotten there a little faster if I would have thought about it more. So that's like my biggest thing. And what I try to impress upon my children is think about what you want your life to be like, because there's so many careers out there. There's not just being a teacher and a doctor and, the standard careers. There's so many things that you wouldn't think about being like I don't know, I was watching a TV show the other day. It was like a historical architect, like you can be anything, like use your
Yes.
imagination and find what you want. And you can find it. And if you're ready to work for it, you can do it. You just don't let anybody tell you you can't, and keep trying until you succeed.
I think that is great advice, and I'm so glad you shared that. The choices are endless for sure, and as your husband will share with you, sometimes there's careers that even haven't been thought up of yet, and so
Yeah.
it's important to be flexible. So, Dr. Pat, I'm going to have you stay on just for a minute, but I'm going to end our recording and end our time with our guests. Thank you so much for joining our Future Focus series. And we're so glad
Thank
you
you.
were able to join us, and join us again next week, when we have another guest. So again, stay on, Dr. Pat, and thank you all for joining us.